Hello, everyone, and welcome to the last episode of The Political Patient for this time period of winter. I'm Anusha.
And I'm sure.
And so today we're going to be discussing the hot topic of the CDC's shortened isolation periods, particularly for healthcare workers. It's important to note that the guidelines we're going to be talking about today do not apply to the public. It is still technically a 14-day isolation period for affected Americans. And that might be winnowed back, but for now, it's still set as that. And we highly recommend you go check the CDC website for all the guidelines pertaining to your specific status and your specific career or profession. So, with that being said, the CDC has recently cut back their isolation periods for healthcare workers. They decided that those who are asymptomatic can return to work after 7 days and a negative test, justifying this by saying that isolation time can be cut further if there are staffing shortages and just in general, a big criticism of the CDC's responses and policies up until this point is that the isolation period feels unnecessarily long for the fact that healthcare workers, a lot of them maybe vaccinated or boosted by now. They're not, symptomatic. They might not be contagious anymore. And it's just kind of adding to an already overstressed healthcare system. And so the CDC has shortened its guidelines. It's worth mentioning that they also say that all those workers who have received the recommended vaccine doses, including boosters, do not need to quarantine at home following high-risk exposures. And the new guidelines apply to all healthcare facilities that are directly involved in patient care. So that includes your hospitals, your nursing homes, dental offices, and other medical sites. And so before we just kind of jump into the details of this, Shreyas, what is your first reaction to what's going on?
Overall, there seem to be a lot of arguments that are being made that the CDC is just changing its isolation periods and policies based on how companies are reacting on how corporations might need employees in their businesses more often. Obviously, and if a lot of employees are now having to isolate, then it can hurt their business. And I think the same can be said for hospitals, and how hospital administrations likely are seeing insane scheduling issues with healthcare workers because they're isolating, and obviously the amount of patients that are coming into the hospital with COVID because of this new highly transmissible Omicron variant is only hurting hospitals even more. So I can see why the CDC may have done this, especially if research supports that isolation periods can be shortened. But I can also see how many individuals might be confused because the guideline seems to be changing often. And I know that people are trying to make infographics and things like that to make it easier to understand what exactly should an individual be doing, what should a healthcare worker be doing in terms of isolating. And I see that a lot of healthcare facilities are at capacity, or very close to at full capacity right now. So I understand why both sides of this argument per se might be frustrated.
Yeah, absolutely. It's worth mentioning, especially with the confusion. I think it's one of the big criticisms of the CDC is just guidance up until now. A lot of people have just kind of been there's just a lot of shifting guidance and mixed messaging, and with the infographics, they're becoming ever more complicated. And you and I both know that infographics are supposed to be fairly just straightforward, laying out the facts. But when you have so many different complex variables you have to throw in, for example, are you vaccinated? Are you unvaccinated? Do you have a booster dose? Do you not have a booster dose? Are you traveling? Are you in a closed space with ventilation? Are you not? It all becomes very complicated. And I think, for example, one big criticism was that, for example, that Britain recently issued a broad recommendation for shortened isolation. The Health Security Agency cut the period for all infected individuals, not just healthcare workers, to 7 days from 10 days, so long as they've twice tested negative for rapid antigen tests. And it's worth mentioning the British government is also taking measures to get these tests to people. And so it suffice to say their system can handle it. In terms of getting people tested immediately and then getting them out there. I mean, I'm sure people have noticed by now that a lot of tests are sold out at a lot of places, at least the at-home ones, and trying to schedule an actual rapid test with an actual body or medical body is very difficult. Suffice to say. It's
Yeah.
worth mentioning though that, for example, Dr. Jha, the dean of the Brown University School of Public Health, was saying that it makes sense to shorten the isolation times based on the fact that um, Delta has shown that in vaccinated people clear the virus far more quickly. So naturally, if Delta is doing the exact same thing and we're seeing Omicron, granted, not much data is coming out, but if Omicron is mirroring Delta's trends, then one would assume that we could apply the same logic, right? Like that's what at least Dr. Jha is saying. Um, I think personally, like my own opinion on it is kind of, I think that the pandemic has really exacerbated labor shortages in general. There's like extensive burnout. They've been like deploying the National Guard to help address understaffing in like nursing homes and hospitals. Getting medical staff back is really important, but it's also really important to make sure we're protecting them. I just don't think there's enough data out on Omicron, and I honestly I do not envy the CDC for making this decision, simply because if we had the ability to get everyone rapidly tested incredibly quickly, if it had the infrastructure, I feel like the CDC guidelines would make even more sense and there wouldn't be more criticism for it. But I think at the end of the day, there's always going to be a certain subsect of the population, just general public wise, who has lost trust in the CDC, unfortunately, and is not going to listen to them. So I definitely do not envy the CDC for this decision.
Further, I just want to emphasize that the information that we're sharing, whether it be about the guidelines or any relevant data, this is as of December 23rd. So by the time you watch this video or it's recorded and released per se, make sure the information may be out of date, obviously, just given the changing nature of the Omicron variant and just COVID-19 in general. So make sure to look at the CDC's website for the most up-to-date information.
Yeah, absolutely. At the end of the day, with science and just health policy as a whole, like it's hard to understand what you don't understand, but we always encourage people to go and do their own research and their own critical thinking. It's really important to come to your own opinions on science, not to sound too lectury. It's always important to listen to the experts, but at the same time, come to your own understanding of what is happening to you and your family and like your own personal situation, and look to experts for guidance, but don't rely solely on them or governmental bodies. Use your own thoughts and critical thinking in this matter, to say the least.
Agreed. Yeah, I was just recently talking to a healthcare worker, and they were sharing that they've been getting emails from administration in the hospital that they work at, talking about how they may need to pull healthcare workers from different departments now to be working
Yeah.
in like areas that they might not typically be working in, just because of these I guess labor-based shortages in hospitals. And it just goes it just another like detail is just a side note really, but in a hospital typically, like if there's a spike in a certain age group per se, usually a different age group has a spike after. So, and right now we're seeing spikes in adults for um the COVID-19, and in the future this might translate to subsequent spikes in children later. So this whole like I guess growth in the number of people who are suffering from COVID and healthcare worker shortage because of the isolation period and just burnout from working in the hospital during the era of COVID might not be an issue that ends by the end of this month or something like that. It might go on for a couple months or a few months. So I thought that was relevant to share.
Yeah, I think this entire situation can kind of be summed up in this one quote from Dr. Daniel Diakima. He is a physician and epidemiologist at the University of Iowa, Carver College of Medicine. He was kind of just frustrated with the whole situation. He was talking about how the fact that like medical professionals even have to discuss this in advance of like guidance from the CDC in general, just any other public health authority, just shows how stressed out the health system is from the Omicron variant, how quickly these new variants, especially the ones who are very transmissible and just capable of like overtaking the healthcare system, really can do a lot of damage. Just because you're not noticing it or you're not involved in it directly does not mean that healthcare workers are not suffering. The system is not stressed. Like we said previously, there are surgeries that are being delayed, like elective surgeries that are being delayed because there's just no beds for people who are recovering from surgeries. They've been all taken up by people who have COVID. And I mean, the only way to get out of this is just to kind of do what you need to do, wear a mask, get vaccinated, and hopefully we'll get to a point where we don't have to worry about these variants, or we're going to have to learn to live with it. One of the two.
Agreed. Well, on that note, thank you everybody for listening to today's episode, and we hope to publish more episodes of The Political Patient in the future. Bye.
Bye.